Today in this video we are going to discuss about the forensic science. தབྷ விஞ்ஞானம் என்று சொல்லப்படுகிறது. In forensic science, the particular topic chosen for discussion is the death, medical legal aspects of death. சட்ட ரீதியான மருத்துவ ரீதியான இறப்பிற்கான காரணங்களையும் அதனுடைய கூறுகளையும் ஆய்தல் மெடிக்கோ லீகல் ஆஸ்பெக்ட்ஸ் ஆஃப் டெத் என்று பெயர். அதை பற்றி பார்க்க இருக்கின்றோம். ஸோ whenever a death occurs which is abnormal, the reason has to be ascertained by means of the forensic science, and particularly we collect the evidence and other things in this aspect, but we are very particular. In this video we are going to talk about how the death is determined. What is the cause of death and other thing is determined by the evidences, medico-legal evidences which is obtained on forensic analysis. Now the medico-legal aspects of death. First, what is meant by death means the irreversible cessation of life. அதாவது உயிர் உடல் என்ற ஒரு இரண்டும் சேர்ந்தது இந்த இயக்கம். இதில் உயிர் போய்விட்டால் உடல் இயங்காது. அந்த உடல் இயங்காததற்கு செசேஷன் ஆஃப் லைஃப் என்று சொல்கின்றோம். இர்ரிவர்சபிள், மறுபடியும் மாற்ற முடியாத ஒரு, அதாவது உயிர் கொண்டு வர முடியாத ஒரு நிலை, that is called irreversible cessation of life. And apart from that is the irreversible cessation of life, somatic and molecular. Somatic, the tissue cells, செல்களும் திசுக்களும் இறத்தல். Classification of cessation of vital functions. The vital functions are come to an end. The vital functions such as movement, the beating of heart, the brain function, and the kidney function, lung function, all these things are come to an end. That is called cessation of vital functions. Stoppage of circulation of blood. Blood circulation will be completely absent in the dead body. And loss of ability to move. There will not be any locomotion and no movement in the body. Classification, cessation of function of brain, lungs and heart. So these three things are very, very important for the functioning of life, and that is called cessation of function of brain, lungs, heart. That is, this is always called tripod of life. The tripod of life completely stopped. That is the circulation of blood, brain function and lung function. Then death of tissue and cells after 3 to 4 hours after stoppage of vital functions. So after stoppage of vital functions, the death of cells and tissues will also happen. Then according to section 2b, as in Birth and Death Act, Birth and Death Act is 1969 specifically says all birth and death should be registered. So in this particular section 2b, the Death Act, Birth and Death Act 1969 specifically says the permanent disappearance of all evidence of life. So there will not be any life activity. That is always called permanent disappearance of all evidence of life. And what the section 2d says, that is the brain and stem death. So we have the brain, spinal cord and stem. Brain consists of the cerebral, that is cerebrum, that is பெருமூளை, cerebellum, medulla oblongata, or otherwise called stem. So this brain and stem death is otherwise is called brain and stem death, and that is very very important for the functioning of life, and that is according to section 2D. The brain and stem death when occurs, that is termed as the death of a person. So Gordon classification of death. So according to Gordon's specification about death, that is defective oxygenation of blood in lungs. Oxygenation should be done in the lungs. That is, oxygen should go to lungs through breathing, that is through respiration, that is inhaling and exhaling. That is defective oxygenation. The lung may not get enough oxygen. That is defective oxygenation of blood in lungs caused by. So because of that, the death occurs. This is caused by obstruction of air passage. Suppose when strangulation happens, or some objects hitting the trachea, then the obstruction of air passage causes. So the breathing will not be there. The air will not go through the nose, external nostril, internal nostrils, and through trachea, then bronchi and bronchioles, and the air sacs in lungs. Then obstruction by strangulation. When strangulation happens, then the air passage is obstructed. In case of hanging and other thing, the air passage is obstructed. Then external compression of chest and chest from falls away. Suppose during rainy days the fall of earth may happen. That is the rolling of earth from hill stations, from mountains may cause. So when a person crosses during that time, that may compress the chest. That is, then because of that, the obstruction of air passage happens. Then external compression of chest, then respiratory failure. The lungs will not be functioning properly. Respiratory failure, and breathing in is vitiated. That is stopped. Breathing is stopped. These are all, when this occurs, naturally it results in death. Then anoxia. Because of these defects, anoxia is caused. Anaxia means oxygen absent. Anaxia, in that the less oxygen or carbon dioxide, excess carbon dioxide will be there. That is produce circulatory failure, lead to death. So this may cause the cells may die because of the less oxygen supplied to the heart and lungs. Then determination of death. How the death is determined? The death is determined by the permanent cessation of circulation and respiration, and this can be identified through ECG and EEG. In some cases, but usually when the respiration, cessation of life or oxygen, cessation of breathing is absent for continuously for some 5 minutes or 6 minutes, naturally we can say that the person is dead. But in some cases, even for 15 minutes, completely the breathing is stopped and the heart beat will not be there, the respiration will not be there. But after resuscitation, after giving the auscultation, that is the pressing of the chest and giving pressure to the heart, then naturally the heart may function. That is called resuscitation. So in some cases, in rare cases, due to resuscitation, the breathing is normal even after 50 minutes. There may not be any life up to 50 minutes. After 15 minutes, even the heart functions normally and all lungs, brain function will be normal. This is rare, in rare cases this happens. So this is with regard to the medico-legal aspects of death. With this we conclude this video.